Well, Amber, here we sit today. We're thinking about exercise, and I'm just thinking you must know something about exercise as a physical therapist.
Well, many of our patients benefit significantly from getting on a regular exercise program, that's for sure.
I bet you're a real drill sergeant.
That's right. Do your reps and do them now.
Does it really make a difference, though, in the immune system?
Well, studies have shown so, actually. They took a bunch of people and studied those who did moderate exercise and found that they significantly reduced their risk for upper respiratory tract infections.
Wow.
Which is great for the flu because that's basically what's attacked.
I guess I better go run a marathon then.
If you overexert yourself, that can actually hurt your immune system.
Oh.
In fact, as you age, they tend to find that your immune system declines, but natural killer cells respond positively to introducing moderate exercise.
Oh.
And it actually increases the number and the function of the killer cells.
Shall I go get on my treadmill in my closet and, do a mile or two?
Well, you could do that, but fresh air is even better if you could go outside. But
we say that perfect health depends on
perfect circulation.
Perfect circulation. Well, if you go outdoors and you put on a big warm vest, some people have the idea that the heart and lungs, that's the furnace room. You keep it warm and it'll send warm blood out. But the rest of you is practically naked. Your limbs are out. This makes it so the blood moves up from the legs up to your abdomen and up to your chest and your brain. You congest the blood in your head, abdomen, pelvis. If your blood is all congested in your chest and in your head, then you won't be able to have a good immune system in that area. It's kind of like trying to get an emergency vehicle on and off the freeway when you're in rush hour traffic. If there's too many cars on the road, nothing's going to happen. And so one of the important principles is making sure your whole body is covered evenly.
Other things to take into consideration is your circulation and how that's affected with your clothing.
Studies show that if you have too tight a belt or elastic around your waist, it slows your transit time of your bowels. It slows your bowels. And if you have too tight a constriction around your chest and you can't breathe as well, you'll have both air movement problems and blood movement problems. Clothing that fits comfortably but not tight helps the circulation to be more even through your body. Well, they say an apple a day
keeps you away.
It keeps the doctor away. Proper diet's very important.
That's true. Very good. Well, let's get started.
Well, first of all, they did some studies on people who were eating a lot of fat.
Now, define a high-fat diet for me.
Well, a high-fat diet would be a diet that has more than 17% of the calories coming from fat.
Okay.
And so that's a pretty big restriction there. The average American diet's about 40% fat.
Wow.
And so if people are eating a normal amount of fat, according to the American diet, it cut their immune systems in half, knocked out the natural killer cells. If they're on a high-fat diet, which, people eat a lot of junk food they had a 79% reduction in natural killer cell activity.
Wow.
But if they were on a low-fat diet, i.e. 10 to 15% of their calories coming from fat, then their natural killer cell activity was increased compared to high-fat diets.
Wow. So you can just completely knock out your immune system right there. It doesn't matter if you eat all the vegetables you want. If you go follow it up with a bag of potato chips and soda, you just dropped your immune system way back down again.
That's right. And the type of fat's important too. A high cholesterol diet was studied in one case, and when they studied the high cholesterol diet, they found out that it knocked out the natural killer cell activity. It reduced it down to 1/4 the usual activity.
Now, do you find cholesterol in fruits and vegetables?
Fruits and vegetables don't have any cholesterol. It takes a liver to make cholesterol, and a fruit, a banana doesn't have a liver.
So any type of animal product, then, is our main source of cholesterol.
That's right. If it has a face, well...
If it had eyes, don't eat it.
If it has a mother... It also reduces the interferon production.
Well, you mentioned cholesterol coming from something that had a liver. Milk comes from cows.
Oh, yeah.
That must affect our interferon levels and killer cell activity.
They did a study in rats and mice. They found out drinking milk greatly reduced the natural killer cell activity.
Sounds that way. You've talked about fat and cholesterol as part of your diet and milk and all those things, but I can still have sugar on my oatmeal, right?
Well, if you beg me enough. Actually, it doesn't matter what I say. Your immune system will tell you.
That's right.
They studied a bunch of mice and they fed them a high table sugar diet, and it greatly reduced their immune systems. It was not good.
Taking everything away.
Taking everything away. Yeah.
This is very good to know. I want to know how to strengthen my immune system. So you're saying go easy on the sugar. Well, why? What does it do to my body?
Well, you know, sugar has a way of disarming your white cells. They would just as soon eat sugar as eating bacteria. They did a study where they took a bunch of people and they took their white cells and they found out that each white cell during a day, during a 12-hour period, could eat 14 bacteria. Well, that's good. That's great. Eat the bacteria. These are bad bacteria that could cause disease. Then they gave the person a 12-teaspoon dose of sugar.
Okay.
Now, what common food would have 12 teaspoons of sugar?
Well, I think soda pop has 11 to 12 teaspoons in it.
That's right, one soda pop. And when they gave them one soda pop, those white cells could only gobble up 5 or 6 bacteria.
Less than half.
Less than half. Then they had 2 soda pops, and it reduced the number of bacteria that a white cell could eat to 1 in a day.
So pretty much disarmed the white cells.
Oh yes, and the average American gets about 32 teaspoons of sugar a day.
Well, all right, I'm getting rid of my sugar. Out with the cholesterol and fat. Bring on some beef.
Oh boy! Studies of mice where they fed them a 25% protein diet showed that it reduced their natural killer cell activity. The best diet for the mice was to have about a 5% protein diet.
Beef had a liver.
Yeah,
so
beef
we want
had
to
a
get our
liver.
protein from somewhere else.
That's right. That's exactly right. And where would we get our protein, Amber? I'm trying to think of a good source.
Well, I hear soy is the new trendy food out there.
From the studies, I understand that soy has shown benefit for people who have the flu.
It doesn't just benefit the flu, but it also helps with cancer because
Oh.
there's such strong antioxidant properties and it's a very potent immune stimulator.
Wow. Well, we all better go get our soybeans, huh?
That's right.
When I was in high school, I had a friend that decided to go on what he called a raw food diet. While we're busy eating other things, he's eating this big bowl of salad every day. You know, you can only imagine how much we teased the guy. And then a few years ago, I got a hold of him, talked to him on the phone. I says, "Hey, how you doing?" He says, "Great." I said, "Are you still on your raw food diet?" He says, "I sure am." I says, "How's that going?" He says, "Great. You know, in 25 years, I have not had the flu, a cold, or any illness." He says, "Before I went on that diet, I was sick all the time. Snot in the wintertime, colds, flu, and so forth."
Lovely.
Yeah, lovely. But the studies have shown that a fresh food diet, fresh fruit and fresh vegetables, greatly stimulate the immune system and definitely reduce the incidence of illnesses.
So not only was he eating none of the things we talked about to avoid, but he was just really eating a lot of raw fruits and vegetables. So
Yes.
that's fantastic. Just kicking that immune system going.
Oh, yes. Greatly increasing the immune system.
Well, it sounds like he was on a plant-based diet.
Yes, definitely.
So what can we get from plants that strengthens our immune system?
You know, plants are high in all kinds of vitamins. They did a study comparing omnivores and vegans. That's a total vegetarian. In that study, they found out that vegetarians had 3 times the amount of vitamin C, 3 times the amount of vitamin E, almost 3 times the amount of vitamin A. They had more copper. They were a little bit low on zinc and selenium, though, and we're going to talk about those because those are things that a vegetarian will want to boost. But they were not too high on cholesterol either, so that was a good thing.
That's right.
They turned around and tested their blood to see if the intake of these increased amount of nutrients made a difference in their blood, and sure enough, they had more vitamin A, C, and E in their blood, and their natural killer cell was twice that of omnivores.
Fantastic. It goes back to our study about the Adventists in Georgia who seem to be
Yes.
doing better than the people around them, especially when they're vegetarian.
You bet.
Apples. They are some
Apples.
of my personal favorites. Can I keep eating apples?
Yeah, apples are great. An apple a day keeps the doctor away, but
That's
there's a
right.
little bit of truth to that. Modern medical science has shown that apples actually improve lung function.
Interesting.
And since it's your lungs that are going to be attacked by the virus, you want to have good lungs. What's more, apples contain phytochemicals. Those are basically vitamins that haven't gotten a letter name because they came along long after the letter people were putting out letters.
That's right.
But phytochemicals actually in apples will inhibit influenza viruses.
Fantastic. I'll keep eating apples then.
Yeah, keep eating your apples.
Now, another way I hear to keep people away is garlic.
Keep people away is garlic.
Apple
That's
a day
exactly
keeps the
right.
doctor away, garlic keeps everyone else away.
And it keeps the influenza virus away as
Well,
well.
that's good.
Yeah, you bet. In fact, there was a study they did where they actually gave people a garlic supplement pill. Those that had the garlic supplement pill had 60% fewer influenza infections during the winter than those who didn't take it.
Interesting.
And there's a relative to garlic, and that's the onion. What do you know about onions?
Yes, there's a particular product in onions called quercetin, and it actually protects against oxidative stress and the lung damage, the epithelial damage to the wall caused by the flu, the influenza. So just like apples and green leafy vegetables and beans, the onion is very good for your immune system and protecting your lung tissue.
And that's what the problem is in flu, is it kills your lungs. And so eating onions and garlic could be a good way of keeping your lungs in good shape.
That's very true. Now, a personal favorite, I hear many people say that if you have wine, it helps you out. But what is it about the wine? It's in the grapes, right? That helps with properties for your immune system?
As we talked about earlier, alcohol depresses the immune system. But the properties in grapes that are good can be gotten from the grape. You don't have to, rot the grape in order to get it. And in fact, there's a phytochemical in grapes, resveratrol, that strongly inhibits the replication of influenza viruses inside the cells.
Well, I know something that looks like grapes. Elderberry.
Elderberry extract has actually been shown to have some antiviral properties against influenza. It can help with actually affecting the viral load. Do you ever eat white bread?
No, actually.
Why not?
Well, I was told it didn't have much nutrient value.
But doesn't it taste better than brown bread?
Yes, with lots of peanut butter and jelly on it. It's very good.
If somebody's only getting 50% of the USRDA of vitamins, their natural killer cell activity was greatly depressed. But we want to make sure we get enough of the good vitamins.
Well, how about folate?
If you're deficient in folic acid, they've shown that will reduce your immune system, both the lymphocyte counts and natural killer cell activity, by 60%.
Well, great. I'll go buy a pill.
Oh boy. Well, I'm glad you mentioned that. Your pills are not the answer.
Really?
They did a study. They took a bunch of people. They found out they were deficient in folate. One group, they split them in half. One group, they fed a good diet, raised their natural killer cell activity back up, increased their body stores of folate. The other group, they gave a supplement to. The people who got the food had a better response in their immune system than those that got the pill. Then they got the bright idea. Well, we'll give the pill to the people who are getting good food too. We'll really boost
Double it.
Double the effect. At the end of the study, the people who were eating the good food and took the pill, their immune system was worse than if they had not eaten the diet or taken the pill.
So it actually counteracted the effect of the good diet then?
That's exactly right.
Well, tell me what kind of food I should eat to get my folate.
What food has good folate? The USRDA is about 400 micrograms. And if you look at 100 grams of food, arrowroot has a lot. It has 338.
Wow.
Wheat germ has a lot. Peanuts, sunflower seeds, spinach, lentils, pinto beans, parsley. A lot of oats have some. One thing I'll let you know, though, there's some foods that have none. And when a food has none, it tends to deplete the system of what folic acid you do have.
So it actually drags out what's in there with it?
Yeah, it makes the body use up its stores instead of providing some. Corn oil. Well, I mean, oil doesn't have folic acid. Potato chips, soda pop. There's a lot of foods that are just basically nutrient depleted.
How about vitamin A? Let's start at the beginning.
Yes, a deficiency of vitamin A reduces natural killer cell number and function. And so you want to make sure you have enough vitamin A. Vitamin A deficiency also results in a loss of IgA producing cells, those B cells that we said were the second line of defense when you're attacked by an influenza virus.
Now, you said taking the pill to get folic acid is not a good idea. Can I take a vitamin A supplement in a pill form?
That's a good question, because in America we commercialize everything if we find out that, you know, fiber's good, well, we have fiber that you can buy
Drink
and
with
eat.
right?
Yeah, you can eat your white bread and send a fiber chaser after it.
That's right.
But you see, the foods that we eat normally have good nutrition, and taking a pill has not proven helpful. Vitamin A. In Finland, they did a study on lung cancer. They found out after they studied the population that the people who had a higher serum level of vitamin A and vitamin E for that matter, had lower lung cancer rates. Voila, let's feed everybody pills. So everybody got a pill. Vitamin A and vitamin E. Lo and behold, the lung cancer rates went up, not down.
Interesting.
They says, what's the matter here? Same thing in America. Prostate cancer did a similar study. Found out that people who had higher serum levels, body levels of vitamin A and vitamin E had lower cancer rates of prostate cancer. Okay, let's feed them all the pills. Yes, pull out the pills. Gave them the pills, vitamin A pills, vitamin E pills. Whoa, what happened? Up went the cancer rates again. You see, let's just take vitamin A for a minute.
Yep.
If you eat a carrot has 273 different active forms of vitamin A. If you get the pill, you get one, and it may not be active. If you get the pill, then you're deficient in 272. Well, how do you know they picked the right one to put in the pill? Well, the best way is to eat the carrot. And same thing with vitamin E. We'll talk about vitamin E in a minute, but sources of vitamin A. Paprika, cayenne pepper, sweet potatoes, carrots, kale, spinach, squash, cantaloupe, even broccoli. Now, you know, they fortify some foods with vitamin A. And you know, eggs, chickens, beef, there is no vitamin A. You're not going to, you know, fight off the flu with a big steak. It just won't work.
Nope.
So that's not necessarily the way to go.
Well, you had mentioned vitamin A and vitamin E as the two vitamin sources that they tested for people with like prostate cancer or lung cancer.
Well, vitamin E is very important for the influenza. The number of viruses in your lungs is reduced if you have a good body store of vitamin E.
Interesting.
And it also prevents you from getting too much lung inflammation. It reduces that cytokine storm effect. So having enough vitamin E in your body is important. So you ought to start now. Don't wait till the flu shows up and then decide you're going to eat wheat germ and, you know, almonds and so forth.
Right.
You need to have a good diet now so your body stores of this food are up. The other thing that happens in the flu is the flu shuts down your brain. It does it in a number of ways. It sends your brain into alpha waves. That also shuts down your immune system.
Sleep.
But it also makes it so you don't feel like eating. Vitamin E will help keep your appetite up.
Okay, excellent. Well, tell me what I can use to get my source of vitamin E.
Yes, we want to get our vitamin E from good food. First of all, sunflower seeds are good, and I'll mention sunflower seeds a number of times here because they do keep coming up as being a nutrient-rich food. Almonds, flaxseed oil has a lot, wheat germ, olive oil, pine nuts, a lot of nuts will have this kind of thing. Oily foods that are natural. Cloves, ground cloves have some. Mixed nuts and seaweed, spirulina. Dandelion greens even have. So you might have a source of vitamin E right in your front yard.
That's right. Forget weeders. Go out there and pick it.
That's right. And by the way, beer, tea, coffee, sugar do not have vitamin E.
No vitamin sources.
Beef has very little, if any.
Well, I love my chewable vitamin C's.
Yeah.
Can you tell me anything about that? Should I avoid those also?
I bet you suck on those like candy,
yes,
huh?
I do.
Linus Pauling would be proud of you. It is a good vitamin, and it's an antioxidant. It helps reduce the inflammation in the lungs. It helps preserve the lungs from so much damage. And if you take it before or during a flu or a cold, it helps reduce the symptoms. So vitamin C is something you wouldn't want to be low on.
Okay.
I don't know that you want to take mega doses, and again, I would be taking that from the natural source.
You seem to really be promoting fruits and vegetables here, Doctor.
I sure am. Who was it that said, let food be your medicine and medicine your food?
Was that Hippocrates?
I think that was Hippocrates. Well, so vitamin C. What kind of foods have good vitamin C, Dr. Bell?
Well, I saw that gentleman eating strawberries on the slide.
Yes.
So definitely strawberries is a good source. Also bell peppers,
Bell peppers.
chives, red cabbage.
Red cabbage.
We see broccoli all through here. Broccoli seems to be a good source of many things. Pineapple, citrus, oranges and lemons, cooked kale, cauliflower, peas, potatoes. But a couple of things don't have vitamin C.
Yeah.
As you mentioned, several others like tea and coffee, salmon.
You mean there's none in fish?
Nope, no vitamin C in fish.
Well, you know I mentioned that vegetarians are possibly low on selenium. But if you get a good selenium build up in your body, it will increase natural killer cell activity by 70%.
Fantastic.
What's more, it helps protect the lungs. It reduces the cytokine storm. It makes it so the lung tissues don't get as damaged, and they recover faster after the flu's been through.
Fantastic. So, you're saying it's difficult to find. Where do we get it?
The best source is Brazil nuts.
Brazil nuts.
I mean, in fact, one Brazil nut is almost like a vitamin pill. It's just incredible. In 100 grams of Brazil nuts, there's 1,900 micrograms of selenium.
And the USDA only recommends 70, so
Yeah.
you're really getting plenty there.
So have a Brazil nut a day along with your apple,
Right.
huh? Keep the doctor away. Mixed nuts, probably because there's Brazil nuts there. Sesame seeds, sunflower seeds. Remember we mentioned sunflower seeds before?
Very good.
Wheat germ, amaranth flakes, oat bran, barley, tofu, white flour, even has a little. Interestingly enough, brown sugar does not have much. So you want to make sure you're not trying to get your source from brown sugar.
Right.
Butter, none. You know, and I guess we're kind of picking on foods that are
That's
nutrient
right.
poor. But you know, there's a number of elements that are important for your immune system.